Okay.
Happy Friday, everybody, and welcome to the internet's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, antidepressants in youth, current trends, and scrutiny. We're going to talk about it. And then, should teens get non-surgical cosmetic treatments? Kind of controversial. I'm going to weigh in on that. And finally, maybe the most interesting topic, facial fillers for your penis. This is a thing, and we're going to go over all the details, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Thank you guys so much for tuning in. We really do appreciate it. Please hit those like and subscribe buttons. Turn on those notifications. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me is Sarah, as always.
Hi.
Hello, Sarah.
Hello.
How are you?
I'm good.
Are you doing well?
Yeah.
I'm glad to hear that. Travis,
Uh-huh.
you okay in there?
I am. I'm good.
All right. Anything exciting happened with you guys since I've seen you last? Big life events, nothing big?
No, I think I said last time I got a dog, but
Yeah, your puppy.
yeah,
Doing good?
Yep.
Puppy training's tough.
yeah,
I had 2 puppies at once with this last batch of dogs, and that was a lot of work.
yeah. I forgot how I haven't
Yeah,
had a
it's
puppy
a
in a
lot.
while. So
Did you guys watch the big USA Canada hockey game last night?
no, I just know that they had some fights though.
Oh yeah, that was the first game. Yeah.
Yeah.
So I actually watched the game. I watched it while I was prepping for the show because I got one monitor and you got. So this is a good question. Do you guys have dual monitors on your computers at home?
I have a desktop computer screen,
Okay.
and then I have a laptop
Oh,
to
so it's
connect to
separate.
it.
Trey, you use
No.
one monitor or 2?
I
One?
just use one. Yeah.
I'm going to tell you guys, it is a life-changing event to get a second monitor if you use a computer, and I've been trying to tell some of my friends this, and it's like they just don't get it. And I resisted this for many, many years.
I like having my
Yeah.
laptop connected to it.
Right.
So it's like 2 screens.
So you use your laptop as a second screen. It's not a whole separate computer?
Yeah.
Oh, okay. So you're basically using 2 screens, yeah. So at my desk, I have my really big monitor. Then I have a somewhat big monitor here, and you can run the mouse between
Yeah.
the 2.
Yep.
And so I like to work, but then have a movie or the hockey game or something going.
Yeah.
It's a game changer. So
How many hockey games are there between USA and
this is
Canada?
some weird thing that I don't really know all the details, but it was, I guess, 4 nations. It was USA, Canada, Finland, and Sweden maybe playing each other, and then it ended up being Canada and USA in the championship, and it went to overtime and Canada won.
What was
Yeah.
the score?
It's 3-2.
3-2.
Yeah.
Okay.
It was a good game. It was
I
very
watched
exciting.
some of it, but not
USA
all of it.
scored first, and then Canada scored. Then I think USA scored, and then Canada scored, and then Canada scored in the overtime.
Yeah.
It was good. Yeah. I mean, obviously, I was hoping USA would win, but
Yeah.
that's the way it goes sometimes. So,
Right.
all right. I guess
Darn.
let's jump into some interesting. This is kind of a first 2 segments is for teens, and then the last one's kind of rated R almost. Not that there's anything crazy, but this is kind of a spicy topic. Maybe a little bit polarizing. I'm interested what you guys think about it, if you're willing to say. And this comes from some recent news from the new Trump administration, and this one's about antidepressants usage with teens and adolescents. And I kind of want to dig into what the current trends are with this and why there's a little bit of scrutiny. And this comes from a recent announcement. I don't know if you guys saw this. I mean, there's so much stuff coming out of the White House right now. It's impossible to remember it all. But some of the things are concerning healthcare I take note of. But Trump asked the new health secretary, RFK, Robert Kennedy. I guess everyone knows. You guys know what RFK means, right? If I say that. Like, does everyone know RFK?
Yes.
Okay, RFK.
I hope so.
I guess, to assess the threat. So they assess the threat posed by children by antidepressants such as SSRIs, antipsychotics, mood stabilizers, and stimulants, as well as some weight loss drugs. And so, I don't know, I figure anytime the White House puts out something, it's always just people on both sides going kind of crazy. And this was pretty similar. There were some people that were panicked that they're, worst case scenario, they're going to ban these things and people aren't going to be able to get their medications, which I don't think will ever happen. And you had other people that were really excited about it because they feel like these medications are either harmful or more moderately, they think they're just being overprescribed.
Yeah, I can see the overprescribed part.
So, okay, what do you guys think about that? Is that something, so I'll tell you, like, as a physician, there are a ton of physicians that think that SSRIs specifically are overprescribed.
What does that mean? What does SSRI mean?
So like Prozac is a really popular one. It's an antidepressant. It's a class of, and I'll explain what they are in a minute, but it's that class of antidepressants like Zoloft and Prozac and I can't remember all the trade names. Do you guys have that feeling that we use a lot of antidepressants here in the United States? Is that like something the general public like thinks about, or is it just medical people?
I don't know. I mean, I've gone to therapy before, and the first thing they ask is if you want to be on medicine.
The first thing they ask?
Yeah, whenever I was like going to therapy.
That's interesting you say that.
They're like, so are you looking for help?
Like, do you want to try medication?
Yeah, do you need to try? And I was like, no, that's why I'm like,
that's why I'm here, yeah.
Talk to you,
yeah,
talk it out.
It's very interesting you mentioned that because that's absolutely one of the things I'm going to talk about. So, I want to give like a very neutral opinion to this. Like I'm not, as always, I am usually kind of in the middle of any kind of debate, because I try to see like all the pros and cons. There's been a lot of,
I didn't say anything.
Oh, I thought maybe it was troubles in my eye. I'm hearing things.
Ghosties out here.
It's the voices. So, there's been some really wild claims about SSRIs. One of them was that kids on SSRIs increase the risk of school shootings, which has been proven false. I mean, there was actually looked into. There was a article in 2019 from the Journal of Behavior Sciences Law that looked at all of these incidents with violence in schools, and they couldn't find any correlation with the antidepressants. So that's been kind of debunked. But there are a lot of people that have taken note that these medications have exploded in the United States, and not just with adults, with children as well. The United States leads the entire world in antidepressant use.
Yeah.
Have you guys heard that one before? Mm-mm. Yeah. And they lead by a lot. There's one country that's actually pretty close. All right, what would be your guess for the country that's actually close to the United
Canada.
States? And that's a good guess, but incorrect. They're pretty high as well. Travis?
Russia?
No, it's not right. They actually, theirs is pretty low. It's Iceland.
Oh, wow.
I don't know why. Maybe it's because it's so dark up there. That may have something to do with it, because it's very high. And so they get these, they get that all-day sun in the summer and then all-day night.
Are there like native people that still live there?
Icelandics, yeah.
Oh.
I don't know where they're originally from, or if they've been there for a million years. I don't know. But there are Icelandic people.
Oh.
Yeah.
Seems like somewhere you'd go for research or something.
That would be Greenland.
Oh, okay.
Yeah. Greenland has like 20,000 people. I think Iceland's they have like a legit population.
Okay.
I don't know how many, but I've always wanted to go to Iceland. It sounds like a cool place. I keep waiting to see if there'll be a music festival there that I could like make an excuse to go. But
What?
So far, no.
A music festival?
Yeah, we travel
And then
for
you'll
music.
go?
Oh yeah. You've had a reason to go. So Iceland is the only country that's close to the United States in antidepressant use, and they are pretty close. But there's a lot of developed countries where like the use of antidepressants is half, which that's a pretty staggering difference. And the use in children and adolescents has actually gone way up. There's an article from the Journal of Pediatrics in 2024 that looked at the antidepressant use in teens from 2016 to 2022, so 8 years. So in 8 years, the amount of prescriptions went up by 66%. Mm-hmm. That's a lot.
Yeah, I think to me, I guess it's because it's like normalized to go like, oh, let's go to therapy, like that's normalized, right. And then so more people are going to therapy, and so it's kind of like likely to think
it's all kind of lumped in together.
Yeah, that you'd get prescribed more because there's more people going to therapy. because that's more like openly a thing now.
Yeah, and I'm
to
gonna
get
I'm gonna
help.
talk about that because that's like one of the gripes that the critics of the kind of the big antidepressant push have is, you know, what the stepwise should be. So you were asking about SSRIs. So that's selective serotonin reuptake inhibitors. So like the big ones are like Prozac, Zoloft. It's like the very most popular class of antidepressants that are used. And what they do is they block the normal reabsorption of the neurotransmitter serotonin. So normally, if our brain releases serotonin to affect our mood, once that neurotransmitter hits a receptor, then it's dissolved, okay, or reabsorbed. And so what SSRIs do is they block that reabsorption so that serotonin still hits the neurotransmitter receptor, but instead of getting destroyed, it's re-released and then it can hit another receptor. And so basically SSRIs will increase the amount of serotonin in your brain. And serotonin regulates mood, regulates sleep, regulates a lot of things that are related to depressive symptoms. And it's very, very clear, this has been established many, many times in the literature, that increased levels of serotonin dramatically improve symptoms of depression.
Right.
Like that's not up for debate. Like that is absolutely a true fact. It can also decrease in anxiety, improve your mood. It's been shown to have a lot of very notable effects in the brain. I should tell you though that it does work best for severe depression. And this is getting into like, okay, who should get medication or who shouldn't. I mean, ideally SSRIs work best for people with severe depression. And also it should be known that it does take several weeks to work. This is not a medication that you take and the next day you feel better. It takes time for that serotonin to like increase in your brain. But there are, why is that important? Well, if people have untreated depression that's severe, like their risk of suicide is quite a bit higher than the normal population. It's like 5 times higher than the general population. And so that's why these drugs have been thought to be like so great, because we know that people with severe depression have dramatic increased risk of suicide, and these medications absolutely help that. And so hence, they are, they're thought of being really good drugs. But they do have some side effects. Most of them are mild or temporary. It's kind of like the GLP-1 agonists that, if you start them, you're gonna have some side effects, but generally they go away. It's insomnia, headache, nausea, diarrhea, joint pain. Probably one of the most talked about is sexual side effects. People that take SSRIs will note that their
like their libido's down.
Their libido's down. Sex is less fulfilling. It's not everyone, but it's a notable amount of people. And one of the biggest reasons that people stop these, there is a little bit more serious risk of bleeding, especially if people take other medications like aspirin. And probably the most dangerous is there is a very rare, very small chance that initiating these medications will increase your thoughts of suicide. Which is obviously bad.
A lot of my family members take that stuff.
Do they?
Yes.
Yeah, you have to be a little bit careful when you first start taking it because it can mess with your brain a little
and
bit.
some of them have been taking them since like they were in high school.
A long time.
Yeah, so I'm like, that stuff has been around me a long time.
Yeah, you just kind of grown up around it.
Yeah.
The one thing that kind of brings us back to the use in teens and adolescents is the research does say that people younger than 25 have a notably increased risk of having that suicidal ideation when they start these medications. However, it's still small. It's not like a huge number, but it is there. And so, the debate over this, I think, has merit because when you look at the explosion of these drugs and the fact that other countries are not using them in the same numbers that we are, I think that the people who question if they're being overprescribed are correct. And the biggest complaint that I think is legit is that they're being prescribed too quickly and potentially to patients that have more mild symptoms where other forms of therapy.
That just need to like have some lifestyle changes.
Correct. You're exactly, Sarah, that's exactly right. Because
it's the same thing with their health though, like nutrition-wise, physical.
Versus starting, Ozempic or something.
Yeah,
it's
the same thing.
And so, it's just a matter of like degrees, right? And so people who have more mild depressive symptoms can often benefit greatly from lifestyle changes or, therapy.
Yeah, increased therapy. Yeah.
And so, that's thought of as being better than starting on medication. In fact, there was a 2023 study in the Journal of Psychiatric Research that showed that a lot of prescriptions for these medications were given after just one visit. which means that they're not trying other things.
Yeah.
You know?
I mean, that's similar, I feel like, exactly to like how Ozempic is prescribed, and you were saying
it
like
is
how
I think it's right. I think it is being overprescribed. Ozempic is, because I mean, I know people that are taking it, and I am not giving prescriptions for that, but I know people who want to lose like 10 pounds that are taking Ozempic. Like, that's crazy.
Yeah.
It's like overkill, right? And so I think that these medications are also kind of being used in that way. So, you know, the big question is like, what's going to happen? Is this investigation going to result in any changes? I mean, who knows? I mean, I think that these drugs have been investigated a lot, and I don't think they're going to find anything earth-shattering. I think the chance of these drugs getting banned is like zero. I mean, all of the research shows that they're extremely helpful. You know, are they being overprescribed? Maybe. I think if anything, they may find that
maybe they need to do some like prevention for childhood, like things that like trauma that most likely happens in your childhood that results in.
And people getting on the meds?
Yeah.
Yeah, I think that,
like
you know,
it's like a
better mental health
thing.
services, I think, are probably going to be an outcome of this. Like, you know, better mental health, maybe more guidelines about when you start the drug versus when you maybe try therapy or lifestyle changes.
Yeah.
I don't necessarily have a problem with them looking into it. You know, I think they kind of are going about it in kind of a negative way, saying, oh, what's this big threat? Well, I mean, I'm not sure there is a big threat. You know, could they be streamlined or used better? Probably. Yeah, I think so.
Yeah.
But are they going to find some smoking gun thing?
Yeah, they're not going to get rid of them.
I don't think so, no. But it is interesting. I think it's a good thing to discuss. You know, I mean, I think that there's a lot of parents out there that, you know, have kids, and, you know, if they're having issues, these things get brought up. And, you know, I think having like a baseline knowledge of it is a good thing. So that's why I thought it'd be worth kind of talking about, and especially since it's been in the news. So we'll see what happens. We may have to do a follow-up once they kind of do their investigation.
Maybe this new generation of people getting therapy will create children that are not being like re-traumatized. You know, like the generational
It'll
trauma.
get better.
Yeah.
Maybe. Yeah, maybe so. All right, let me recap this in real quick, Trey. So today we were talking about the kind of explosion in the use of antidepressants in teens and adolescents. And the research shows that is happening. The use of antidepressants in the United States is way higher than almost all countries. Iceland's the only country that's even close to us, and a lot of developed countries have half the antidepressant usage. And specifically in teens, it is exploding. There was a recent study that came out that showed over an 8-year period, the amount of antidepressants prescriptions for children increased by like 66%, which is a really big number. And so the Trump administration is having RFK, the health secretary, look into the usage. And, you know, I don't think they're going to find any smoking gun things that we don't know. These drugs have been talked about for many, many years. I do think that there is probably some overprescribing going on of these medications. There's a study from the Journal of Psychiatry that showed that a lot of times these patients get on these medications after only one visit, which really these medications should be reserved for more severe cases of depression. For milder cases, things like therapy or lifestyle changes tend to work well. So it'll be interesting to see what they find. I don't think anything earth-shattering will be fine, but we will definitely keep on top of it. And if they find anything, we'll let you know. So, all right, moving on. Got another teens. It's like 2 sections about teens. You guys are going to have to weigh in on this. This one is about teens and non-surgical cosmetic treatments. Should they get them?
Okay.
Yeah, it's kind of interesting, right? When I actually have a little bit of experience with this. I actually saw an article from U.S. News and World Report. Throw it up there, Trey, in case anybody wants to check out the article that I was looking at.
So there's a bunch of teenagers getting lip fillers.
Yeah, I'm not a big fan of that. Yeah. So this article came out, and you know, of course, it's going to be talking about social media. That social media is kind of teasing teens with these treatments because there's celebrities using them, there's influencers using them, they're seeing these things, they're thinking, well, if these people are doing it, maybe I need to do it. I will say that I haven't seen a lot of that in my practice, to be honest with you. I have a couple cases I was going to talk about, but not like this big rush of teens breaking down my door for lip filler. It did discuss some data from a recent poll from the University of Michigan Children's Hospital. The data was kind of all over the place, to be honest. I was reading and I was like, this is not super coherent, but basically the gist of it is like 1 in 6 parents support their teens undergoing non-surgical cosmetic treatments. That probably sounds about right. What's that, like 15 to 18%? Yeah, that's probably about. I was just thinking how many people would say that that's okay. Half of the parents said that there needs to be a valid reason for them to get these cosmetic treatments, but then of course there was this huge debate on what's a valid treatment. You know, they were talking about things like bullying. You know, is it okay if they're being bullied about something for them to get a cosmetic treatment?
Yeah. I mean, one of my friends in high school, she had a very large nose.
Okay, and so she got a rhinoplasty?
Uh-huh.
Yeah.
But she didn't get it until she graduated from
Really?
high school.
See, I personally...
That was like part of her graduation, was getting that.
I personally don't have a problem with that. I mean, I've done actual cosmetic surgery on teenagers, but for things like that, well, the one that I see the most commonly is there is a not, you know, insanely rare phenomenon where a girl will have one breast that's fully developed and one that's completely not there. And then suddenly, like, that becomes a big, you know, life
Source of embarrassment.
Yeah, source of embarrassment. Like, it affects your life and your you know, ability to just, you know, be in public or be in the gym or, you know, athletics or whatever. And so, you know, if I get somebody bringing me their kid for something like that, I mean, obviously I go over like everything with them and what's involved, but I have no problem operating on a kid for that.
Yeah,
you know,
I wouldn't either.
Versus, like, you know, if somebody brought me their 17-year-old and said she just wants a breast dog, I'm like, I don't think so.
Yeah.
I personally wouldn't do that. Now, when people turn 18, they're adult, they can do what they want. But, you know, underage people, like, if there's like a medical reason, sure. But yeah, so it was interesting. Like, the data on people's opinion on this was all over the place. A third of people said that it should be banned, which I think is silly. I mean, I don't know. I'm not a big fan of banning stuff just because I don't like it. But yeah, a third of people said that cosmetic treatments for kids should be banned. It did mention that it's important to ask teens why that they're wanting to have these treatments.
Yeah.
And I do agree because, you know, I'm kind of like, again, like a middle of the road on this. You know, I think if there's a legit reason to do it, then I would be more open to it than, you know, if my daughter came to me and said, hey, I want to get lip filler. I'm like, yeah, I don't think so. So I want to kind of give my opinions on this because I do have some experience with this, with having both the plastic surgery practice and a med spa. And of course, like, you know, you're going to get kind of a balanced opinion from me. I obviously don't think they should be banned, but I do think there should be very good reasons for a teenager to seek out a non-surgical cosmetic treatment. So I would kind of go through them. So I'm just going to start at the bottom and work my way up. So like hydrofacials, I mean, my daughter's gotten a hydrofacial at my office when she was there for just hanging out.
Yeah.
I mean, hydrofacial is like basically just a deep cleanse of your skin. I mean,
Yeah.
I don't have a problem with that whatsoever. It is helpful for your skin. It can unclog pores. You know, I mean, if a teenager wants to do a hydrofacial, I have zero issue with that because it's so non-invasive.
Yeah, I wouldn't even think of that
Okay,
as
so
something.
you'd be on board with hydrofacial?
Yeah, I wouldn't even think of that
Yeah.
as like a...
I really wouldn't either. Okay, here, so
thing.
we're gonna go up the ladder. Trey, would you let your kid that you don't have get a hydrofacial? You know, hydrofacial is just a cleansing in the face.
No, yeah, that sounds pretty alright.
Okay, I agree. I'm with you. I'm like, yeah, that sounds fine. Okay,
Yeah.
we're gonna go up the ladder though. All right, what about laser hair removal? Now, let me tell you what's involved. Nowadays, that's just running a light over your skin. I mean, it is pretty
Chill.
basic. Yeah, it's pretty chill.
Yeah.
Yeah, I think I would too. I mean, if my kid came to me and said, "Hey, I'm not going to mention a location, but like, when I shave, like I'm getting these, you know, rashes or whatever. Could I do laser hair removal?" I'd be like, "Yeah, sure." Like, I don't have a problem with that.
Yeah, especially like for sports. Like
Okay, for sports, okay. Because to me, that's like
I was a gymnast, and I, you know,
Right.
I had to shave my legs all the time.
Of course, and if you were,
Yeah.
you know, if you can shave, fine, do it. But if you can't, I mean, I don't have a problem with that one either. Trey,
Yo,
You're
that
okay?
one seemed pretty tame.
okay, I agree. All right,
that
we're all,
one seems
so
pretty
we're all good. Okay, what about teeth whitening? Now,
Yeah.
generally, that's not. I've actually done it a time or two. They basically do it with a light.
I've got my teeth whitened too.
Okay, would you let your teenager do that?
Probably.
Now, the only thing I'm going to say is I don't think most teens need teeth whitening.
Yeah, right.
Their teeth are already white. Like,
I would say no, just because I would feel like they need to just go ahead and put the work in to make your teeth whiter. You know what I mean?
I don't have a problem with that, Trey.
A lot
I mean,
of orthodontics, like after they put braces on you,
they do the teeth
they
whitening.
do
Yeah.
they do teeth whitening
So,
after they get your teeth straight. and all that
I
kind
would
of
say
stuff.
probably not because I don't think they would need it unless maybe they had some weird staining from
Right.
something. Maybe.
Yeah, for sure.
Okay. Okay, we're gonna go up. What about cosmetic Botox?
No.
Trey?
Yes. No, I'm just playing. No.
Yeah, I'm with
I
you,
say
no.
no.
I'm a no on that as well. Now, I'm gonna differentiate that from medical Botox.
For migraines.
For migraines, or like the other one is occasionally you'll see is hyperhidrosis, where people sweat just profusely.
My friend used to get Botox in her armpits. She
Right,
was a
for
gymnast.
hyperhidrosis. Okay, so what about it? What if your teen had hyperhidrosis and they couldn't wear a dress because they were sweating through it?
Yeah.
Or maybe it was a boy. I
Yeah.
think I would do that too. I wouldn't have a problem with that.
Yeah.
Because to me, that's medical. It's not cosmetic.
Yeah.
Trey, sweating?
I'm like, is that safe? Is that safer than using like prescription grade deodorant with aluminum and stuff in it?
It is pretty safe.
Yeah.
There's
Is it better for you than using heavy aluminum deodorants?
Who knows, man? I don't think anyone can answer.
I don't know.
Okay, what about lip fillers?
No.
Your
No.
16-year-old wants lip fillers. Okay, I agree, 100%. No way.
nah.
I'm out. Okay, we're gonna move up a little bit. What about like the IPLs? So IPLs are like your broadband light. See, the problem is you guys are probably not familiar. So I'm not gonna ask this one because this one's hard.
Is that
for
like
you.
to remove like scarring on your face?
It could be. It could be like blemishes. Like if you get vascular blemishes, like birthmarks, it could help. So like I have maybe on this one because it actually is pretty good at treating acne as well.
Okay.
And so if it's treating acne, maybe, or like birthmarks, I'd be fine with that. Chemical peels, I said no. Kids shouldn't need a chemical peel. Like I just don't.
That sounds invasive.
Yeah, that I don't think so. And then the last one that I had here would be like the highest level, which is lasers or microneedling. Now, I think most people would say no, and I would agree with that. But the one exception being, those treatments are very good for bad acne scarring.
Yeah.
Or like if you have a scar from some sort of traumatic event.
Right.
I think in that instance, I would be okay with it.
I think I think severe acne is considered a medical issue, right?
Yeah, but I think getting rid of the scars is considered more cosmetic. And I've treated teens for this in my office. I don't have a problem with it. I would never let my daughter do a halo laser treatment just because she wants to make her skin tighter. Like that makes no sense.
Yeah. Where's it going to get tightened
Yeah,
to?
right. It's like
Where's your skin?
So yeah, I'm kind of like middle of the road on this one. I think for things that are more fixing a problem versus just cosmetic.
Prevention.
Yeah, I think I'm okay with it, but I think we're all pretty like on it. I think we're all pretty level-headed here.
Yeah.
I appreciate
Yeah.
that about you guys.
I say we're on the same page.
Yeah, I think we are. All right, let me recap this real quick, Trey. Today we were talking about the big debate on whether teens should have non-surgical cosmetic treatments. So things like teeth whitening and lip filler and lasers and all of that. And there was a study that came out recently talking about parents and their thoughts on this. And of course, it was all over the board. So we went through our list and talked about what we would let our teens potentially do. And I think all of us on the show are pretty level-headed. And we all kind of agreed that the only thing we'd really let our teens do are things where we were correcting an issue versus doing some sort of preventative treatment. So no, we're not letting our teens get Botox or lip filler or anything. But if our teens had something like bad acne scarring where a laser or some microneedling could make that scar better, and I think that that's a little bit more reasonable. So it was a pretty interesting topic. If you want to check it out, then go to YouTube and see the full segment. So, all right, this may be one of our hottest segments we've ever done. I have a friend, Robert, who is begging me to talk about this because I think he really wants to have this done. He's making very rude gestures at me right now, I'm sure. No, he actually he put me on the track of this one, and it is a good topic. It's pretty interesting. So this is a segment about facial fillers for your penis. I have to thank my friend for pointing this out to me because I didn't see this one. He sent me a link and I was like, oh yeah.
What is that tape measure?
What do you think they're measuring?
What's the name of it though?
Oh, Falafel. Oh, you were asking the name. Yeah, we're gonna get there. That's the drug. Falafel.
Oh.
Like phallus.
Yeah.
Yeah, Phil.
Yeah.
It's pretty clever, honestly.
Gross.
So, yeah, I did a lot of research on this. So this, by the way, if I die suddenly, I need someone to go erase my computer at home Because there's some now I'm getting these weird pop-ups on my computer now that I don't want.
For like penis enlargement
Yes,
stuff?
yes, for penis enlargement. And like, I just want you guys to know I went the extra mile for y'all. I should have used a VPN or something.
Should
and I
have
didn't
used,
think
you
about
should have
it.
used
I'm
your
just like
wife's
typing,
computer.
Huh?
You should have used your wife's computer at UNT.
I should have done that. But yeah, so Trey, I'm gonna need you to break into my house if I wind up dead and like burn my computer down before anyone looks at it. All right.
I got you.
So this was pioneered by Bill Moore, a Dallas local, yeah.
All right.
Dallas shout out. And he developed a product called Fallowfill. The name of it, hey, throw that picture up there one more time, Trey. Fallowfill. It was on that little tape measure. Yeah, there it is. P-H-A-L-L-O-Fill. And this is basically hyaluronic acid, which is just dermal fillers. It's the same stuff that people inject in their lips and in their face. And they're using it in the penis to increase girth. So I actually went to a lot of web pages. My computer's I'm probably gonna have to burn it, to look into this, because I wanted to get the real information and not just like, haha, this is a joke. Like, this is a real procedure. And at first I was like really kind of thinking that this is a super bad idea, and I don't think it's quite as super bad idea as before, and I'll explain why. So what they're doing is they're injecting filler along the shaft to increase girth. Like, this is not a lengthener, really. This is a girth improver.
All I keep thinking about are those Austin Powers movies.
I know, right? Is this your pump? Nope. It was in your bag, not mine.
Oh, God.
Yeah. So my first question was, I've done tons and tons of filler. Filler comes in a vial of 1 cc. Mm-hmm. That's not a lot, 1 ml, okay? Allegedly, and I say this allegedly because I've never done this, obviously. I did look at some befores and afters. Yes, I'd include them in the show, obviously. But they say that 4 vials will increase girth by 1/4 inch. Okay, that sounds probably about right. So how many vials do people get? Well, there were 4 sets of treatments. There was 4 vials, 6 vials, 10 vials, and 20 vials. But they can only do about 5 to 6 per session. Okay? So if you do 10 vials of this stuff, you can increase your girth by 5/8 of an inch, which, that's not insignificant, right?
It's crazy.
How much is that?
5/8 of an inch.
I know, but how much money is 10
Oh, we're getting
vials
to that.
of...
Yeah, we're getting that.
Wow.
Yeah, it's money. If you do 20 vials,
These men must be desperate.
if you do 20 vials,
God.
you can get 1.25 inches in girth. That's not an inch and a quarter is not nothing. I'm surprised that they're getting that much, but 20 vials is a lot.
Go do steroids or something. That's cheaper.
I don't think that does the opposite.
I
Yeah.
was
No,
gonna
I
say
know.
steroids
That's
take
what
it
I'm
the other
saying.
way.
Oh, don't do. Oh,
No,
don't.
I said go do steroids so you can have muscles.
Oh, so it doesn't matter. Yeah.
It doesn't matter as much.
Yeah, it doesn't matter. So allegedly 10 vials is the average. And so Sarah wants to know how much this is. I know everyone's just dying to know how much this stuff costs. So I was assuming it would be very close to what the fillers cost, but they're getting a little bit of premium to inject them into a penis. So 4 vials is going to run you $3,000. 6 vials is $4,000. 10 vials, which is the average, is $6,000. And if you want to go all out, like, what was that Dirk Diggler? If you want the Dirk Diggler treatment, it's 20 vials. You guys know who Dirk Diggler is?
No.
Really?
Who the
Oh
heck
my
is
God, it's the guy from the porno movie. It was Robert, tell him who Dirk Diggler is.
Dirk Diggler?
Is he that creepy looking?
Marky Mark. It was Marky Mark in the movie. What movie was it, Robert? You remember? I can't remember. It was
Mark Wahlberg?
Yeah, Marky Mark was Dirk Diggler, and he had like the enormous penis.
Oh.
Not like Ron Jeremy or somebody.
No,
right?
that's a real. That's a guy's
That's
a
a
real.
real
He's a real
porn
porn
star.
star.
Oh, okay.
That's what I thought you were
What
talking
movie was
about.
Dirk Diggler? Boogie Nights. That's the one. Oh my God, that was a long time ago. Never mind. I'm not surprised you got to know that one. All right.
That's hilarious.
Anyway, if you want the Dirk Diggler treatment, even though you don't know who that is, that's 20 vials at $10,000.
Dang.
10,000.
And it doesn't really do that much.
Well, I don't know, 1.25 inches of girth, like.
Is this permanent or does this like?
Great
go away?
question.
It
Trey.
isn't permanent.
It is not permanent.
It's like $10,000 a year or something.
Yes.
Wow.
Filler only lasts about 1 year to 1.5 years.
Well, that's why you got a year to get you a wife and then
Can
see
you
later.
imagine if you like went out there and this false advertising. That
remember that man that sued his wife because she had all this plastic surgery done and like their kids turned out to be like super ugly or something?
I do remember that.
And he was just like, you lied to me.
This is lies.
They come out looking gross.
So let's get back on to, does it function normally? Yes. Now, the question
What if it didn't?
Yeah, then obviously no one would do it. But the question I had is, does it look normal? Because I'm thinking, I mean, we always talk about when people get too much filler and they look weird, right? And I'm thinking 20 vials of filler, like in your penis, like that's not gonna look right.
I wonder if they have like specific patients that they're like, no, we won't do this on you because it'll look weird.
I don't know. I don't think so, because they were all ready to get my information. They were like, give us your email right now. I'm like, no, please don't put any cookies on my computer. Okay, but I'm going to tell you guys, I wanted to...
Give him Chalvis's email.
I put your email in there.
I'm okay. I appreciate it. Genuinely appreciate it.
I did go look at the before and after pics, because I wanted to know, does this
look... Is it attractive?
It looks normal, like at least in the two befores and afters that I found in this one clinic that does this.
Interesting.
I would not have known that they necessarily had anything done, and it was starting at like treatment 0, then after 4, then this one person had 20, so it was like 4, 5, or no, I guess it was 5, 10, 15, 20 total vials. I was like, yeah, it looks good to me. I mean, it looks like a penis. Like it didn't look like a.
Looks good to me.
It didn't look like it had like bumps or.
So you just like, so if you saw that guy at the gym, you'd be like, good job.
Whoa.
No, I would have been like, dude.
Fist bump.
I'm like, yeah, bro. Like that's impressive, man. Like,
Gross.
I mean, you know.
That's interesting.
I just figured that maybe it would look bumpy or like look too swollen, or like a sausage that had like been in the fire,
like
and they split open. Yeah,
when
right.
They get like a lot of.
You ever
filler?
like drop the hot dog into the campfire and it gets really big and then it starts to split? Like I didn't know maybe it looked like that.
Yeah. The fact that you have to do it so frequently, too, not frequently, but
well,
you have to do it every
year.
so often.
Yeah. So like that
wild.
was my biggest concern. I actually, so I looked at this. The safety profile looks pretty good. Like there was not any people complaining that their penis bursting or anything like that. Yeah, or didn't work. The appearance of it looked fine to me. So I think it's kind of pricey. If it was permanent, then I could see more people doing it. But having to do that every year, a year and a half, like I don't think so, man. Like I don't like needles. I sure wouldn't want a needle in my penis. Like that sounds terrible. That sounds really terrible.
Yeah, I'm not a fan.
I'm out, man.
2 out of 10, do not recommend.
Yeah, I don't think if somebody was trying to offer this
0 out of 10.
If somebody was trying to give this to me for free, I would say no.
Like some people probably could find some benefit out of it. If you have the extra money to do it and you see you need it, then I mean, swing for the fences.
And being a doctor, I can tell you, and I don't think everyone maybe knows this.
It's not
but
for
like
your average person to get.
Right, it's not for your average. There are people out there who, sadly, they just weren't, blessed in that area. It's like the girl that's like a AA cup competing with the girls who are, a C cup naturally, right? I mean, it happens. And so I think for those people there were testimonials and people telling their sob stories and then how happy they were after. I was just like, oh, well, I mean, yeah, it sounds great if you need that.
$10,000 later.
Yeah. So I don't know. I think that for certain people this might be good. I mean,
yeah.
I'm not
extra money to do it.
I'm not like endorsing it, or I'm certainly myself not going out and having this done. But I mean, I don't know. I mean, I think after doing kind of a deep search and now having to burn my home computer, I think that it's not as crazy as I thought when I first saw the article. I'm being honest with you. So,
very interesting.
Yeah. All right, I'm going to recap this one. So today we did one of the more interesting topics in the history of Nip Talk. We did facial fillers for your penis called Falafel. This is a new thing coming from Dallas, Texas, where it originated. And I did a deep dive on this. I'm going to have to burn my home computer now. I obviously can't let this thing survive because I've I've looked at things on there that should not be looked at. But after looking at all this, it actually is not the craziest thing ever. So they're basically using hyaluronic acid, which is the same as the facial fillers, to increase the girth of penises for people who need that kind of thing. And it is kind of pricey. I mean, it'll run you anywhere from $4,000 to $10,000 depending on how many treatments you get. But people who get 10 or 20 treatments actually get pretty big changes in this. I was really concerned about what it might look like. And so, yes, going the extra mile, I did look at the before and after pictures on these websites, and honestly, it looks pretty normal. I mean, I can't really tell the difference. I mean, I can tell the difference from start to finish. It looked bigger, but it didn't look lumpy or weird or anything. So my biggest concern, though, facial fillers or hyaluronic acid fillers are not permanent. They go away after a year, year and a half. So yeah, if you're going to keep this up, you're going to have a lot of needle sticks to your penis, which to me just sounds like terrible. So I'm personally out on this one. Trey said he was out as well. But for people who really need it, I don't think it's a terrible treatment. I mean, it's kind of a new technology, but for those who need it, it looks sort of promising, I guess. So not endorsing, but I'm just saying it's out there. Falafel. Yeah, check out the episode.
Are there surgeries for permanent,
there are, but
permanent
but none of them are great. None of them are great. Like I should have probably mentioned that. I looked at when I was reading all the information and the articles. It was even the urology people were weighing in on it, and they're like, "Yeah, it seems like it might be okay." But they were talking about the surgeries and the fact that a lot of the surgeries are not fantastic.
So real quick, Cindy Hermann said, why is Sarah trying to get me in trouble with the IT team at work? She also had the answer for Boogie Nights. I don't remember the Dirt Diggler.
Dirt Diggler, yeah.
She had the answer.
I knew
for that.
she would know it. She always knows those things.
And she also said that you should have the inventor on the show as a guest. The inventor for
Falafel.
Yeah.
We should. Robert.
I thought she was about to say
Robert.
you should get it.
No. That's not what she said.
Because
she wanted me to get it?
Because
Oh,
the sentence started, you
Yeah.
should. I was like,
You should.
wait, Cindy, about
Yeah, maybe
do
like a
that.
reduction surgery. I don't know.
There we go.
Sure.
There we go, Dr.
I mean, I've already had 2 of them. I don't know how many reduction surgeries you can have.
Yeah.
Gross.
Off the rails today.
There we go.
Hey, Robert, reach out to this Falafel guy. Let's get him on here. All right. Hey, thank you guys so much for tuning in. Hope you had a good time. Talk about some fun stuff. We'll see you next week on Nip Talk.
Bye.